Peptic ulcer is one of the most common problems which is seen in the gastroenterology field. What is peptic ulcer? What are the causes for somebody to develop ulcer disease? How do we diagnose this problem? And what are the treatment options available to cure somebody of peptic ulcer disease? By peptic ulcer, we mean ulcer which forms in the stomach or in the first part of the small intestine called the duodenum. As we all know, the stomach is an organ which secretes acid, and this acid is very important for digestion of our food. Nature has made it in such a way that even though the stomach secretes acid, this acid cannot injure the stomach because there is a protective coating of a mucus layer which protects the stomach itself from being affected by the acid. Due to various reasons, when the acid starts affecting the stomach itself, the main organ which produces the acid itself gets affected by the acid. The stomach gets injured and this causes small wounds in the stomach which is referred to as peptic ulcer. What are the causes of peptic ulcer disease? There are various reasons for somebody to develop peptic ulcer. Basic mechanisms can be divided into two. One, when somebody produces more acid, that is injurious to the stomach, or the acid production is normal but due to some reason the mucus coating, which is a protective coating of the stomach, becomes thinned out or deficient. Then even normal amount of acid can affect the stomach and cause ulcer. Certain conditions which predispose somebody to have peptic ulcer are stress, smoking, alcohol intake, improper dietary habits, and most importantly, there is a specific bacteria which is known to cause increased incidence of peptic ulcer disease, and this bacteria is called Helicobacter pylori or H. pylori. This is one of the most commonly prevalent bacterial infections in the stomach, and this has been linked not only to peptic ulcer. In the long-standing cases, it can also lead to stomach cancer. So what are the symptoms which somebody will have when they have peptic ulcer? The most common symptom of peptic ulcer disease is abdominal or tummy pain. This pain is classically located in the upper part of the abdomen, the segment above the belly button. It can be in the form of a burning sensation, in the form of a crampy pain. It can cause gas bloat sort of symptoms. It can lead to decrease in appetite. It can also cause something called early satiety, where even after taking a small amount of food, somebody feels that they've eaten a lot and they are full. It can cause a prolonged period of fullness after eating. Like somebody has breakfast at 8 o'clock and he does not feel hungry till 3 or 4 in the evening and he feels that the food has not digested. This also can be a symptom of peptic ulcer problem. So when these symptoms happen, one should suspect the presence of peptic ulcer disease. How do we diagnose peptic ulcer disease? Many of the patients can be diagnosed from a detailed and focused history. To confirm the diagnosis, there is a simple test which many of you must be aware. It is called an endoscopy, wherein a fiber optic tube is passed into the mouth up to the stomach, and with the help of a magnified view, one can study and examine the entire stomach and the first part of small intestine, and this can diagnose ulcer. Not only can this diagnose the presence of ulcers, it can also take small bits of tissue which can be studied for the presence of the Helicobacter pylori infection. Why? Because if somebody has the Helicobacter pylori infection and has got peptic ulcer disease, a simple cure of this bacteria itself will lead to the cure of peptic ulcer. So what are the methods of curing peptic ulcer? Luckily, majority of the peptic ulcer problems are cured with medicines alone. The need for surgery to cure this disease is very, very limited. The treatment focuses on two things. One, medicines which decrease the acid production. Two, medicines which improve the gastric protective coating. And three, if the patient has got Helicobacter pylori infection, a 14-day course of antibiotic therapy to cure the Helicobacter pylori infection. In certain cases, there can be some complications because of peptic ulcer. This happens because somebody has neglected the peptic ulcer for a long time, or the peptic ulcer is very severe. It can cause complications like bleeding. The ulcer can start oozing blood. This can happen as the patient vomits out blood, or it can even come through the motions as a black colored stool. Rarely the ulcer can be very deep and it can go through and through the stomach and cause a hole in the stomach, and this is called peptic ulcer perforation. Sometimes the ulcer can be so severe and can be so long standing that it causes a narrowing of the outlet of the stomach, whereby the stomach's outlet gets closed, and these patients come to us with vomiting. Whatever they eat cannot go down into the small intestine and they come back with repeated vomiting. These are the patients who have bleed, or who have got a perforation, or who have got an obstruction because of ulcer scarring, are the patients who will benefit from surgical therapy. The surgical therapy aims at decreasing the acid production by cutting the vagus nerve, which is a main trigger for acid production, and it also can be used to create a bypass in cases of obstruction, or to close the perforation with a patch. Surgical treatment depends upon the type of complication patient has. For patients who have got a perforation where there is a hole in the stomach, the surgery can be used to repair the hole with help of a patch. Patients who come with a block in the outlet of the stomach, laparoscopic surgery can be used to create a bypass whereby the stomach's food can directly pass into the small intestine, bypassing the blocked area. The incidence of peptic ulcer disease in the recent time has been increasing because of two reasons. One, because of increased prevalence of H. pylori and increased use of medicines such as aspirin and other painkillers, which also can increase the incidence of this problem.